All right, I am going to get us started. So exciting on multiple levels that this is the last seminar of the semester. And so very excited to have Jane Gilbert here to be our final seminar speaker. Jane Gilbert is the Chief Heat Officer for Miami-Dade County. Gilbert works across departments and partners to address the increasing risks to human health, lives, and livelihoods associated with extreme heat. She has over 30 years experience in public-private partnerships, climate mitigation and adaptation, and urban resilience. Before joining the county, she served as the city of Miami's first chief resilience officer for 4 years. We have the full bio available to you, and I'm sure she'll tell us about many other parts of her journey. But join me in welcoming Jane Gilbert.
Thank you. It's really a pleasure to be here and for I learned so much interaction. Look forward to your questions later. That's where I get the most out of these kind of interactions. I've said this speech a few times, so it's more your questions and the dialogue that engage me the most. So just a little bit more about my career. I studied environmental science undergrad. While I was there, I got a fellowship. This is just a connection to public health. My interest in public health happened. I got a fellowship to work on a documentary series on tropical rainforest management problems and solutions. And after spending 7 months in the rainforest, came back, was working with the filmmaker in St. Louis, and came down with malaria, and went to WashU University to hospital get treated. They hadn't seen malaria since World War II, so they were all excited. They brought in all the research students, and I got to see the malaria, whatever. I got very interested in vector-borne diseases as a relate, and I thought, oh, maybe I'll go to grad school in public health. Anyway, I didn't end up going to grad school in public health, but it did get my interest going. Anyway, after that, I did work for about 5 years more nationally and internationally, both on environmental risk management for large corporations and for the big nonprofit that was doing fair trade ventures in the rainforest. But when I went to grad school, I ended up getting a master's in public administration, but really wanted to work on urban community work, like live and work in the place that I would see the impact. And so I took courses related to health, education, and the built environment on how you can impact people's lives and the economies in the local environment. If a chief resilience officer, a chief heat officer position had been available at that time, that probably would have been what I would have been super excited about, but it didn't exist at the time. So I work within an office of environmental risk and resilience, and there's a chief resilience officer, there was a chief bay officer. We're going through our own county DOJ experience right now, so there's a little consolidation going on, but we have a lot of strategies. They're all very integrated. We started with a urban resilience strategy that we developed as part of our participation in the 100 Resilient Cities Network. The county, city of Miami, and Miami Beach worked on it together. So when I was chief resilience officer for the city, I was involved in the creation of that strategy from that perspective. And then the county has its own sea level rise strategy, its own carbon mitigation strategy, and a bay, Biscayne Bay, our aquatic preserve. It's been under major threat environmentally. And then 4 years ago, the mayor hired me to address the increasing health risks and economic burdens associated with extreme heat. So Miami, as you may know, is kind of the international poster child of risk for sea level rise, for hurricanes. And extreme heat was not something that they had addressed before my position was created, really. And why that? Well, two things happened. One, on the ground, a group of community-based organizations received foundation funding to do a series of focus groups and surveys in our socioeconomically vulnerable communities about what people's top concerns were related to climate change. And it wasn't sea level rise. And even though Hurricane Irma had hit them pretty hard in 2017, it wasn't hurricanes. It was extreme heat, because that's when people were living day in and day out, whether it was they couldn't afford their utility bills anymore, or their AC breaks down in July. Or one of our 300,000 people that work outside every day, or their grandma who's walking and waiting at a bus stop for a long period of time, highly exposed, or their kids can't play outside anymore. The extreme heat that was people's top concerns, and the mayor heard that. At the same time, we're involved with Resilient Cities, the organization that Rockefeller founded after 100 Resilient Cities. It's this Arched Rock Resilience Center at the Atlantic Council in DC, and they decided to focus on extreme heat in cities. Miami-Dade County was one of their first community partners, and they came up with this idea of a chief heat officer to work across departments and with external partners to focus on extreme. And so the mayor in May of 21, so now just about 4 years ago, appointed me to do that, to address the increasing health and economic impacts of extreme heat. And you all know it's the leading weather-related killer, that we're grossly undercounting heat-related deaths. And according to the CDC, it's about 700. Depending on how you do the studies, it can be multiples higher than that. He did a excess heat mortality study. I contracted someone from Florida State University, I did not do the study myself, to look at all-cause mortalities in the 5-year period pre-COVID. He actually did it twice. He did it once just looking at high heat days, and that came back at an average of 34 deaths a year. Then he did it looking at the 3-day lag effect, and it came back at over 600 deaths average. Same mortality data, same 5-year mortality data, but so we don't know. We just know it's a lot larger than the number of heat strokes and heat exhaustion out there. And it doesn't hit us all equally. We're all at risk, but different populations are more exposed or more sensitive. And so you need to design interventions to address those different populations. And it's increasing everywhere. They're saying by mid-century, 2/3 of the US will be exposed to dangerous heat waves. And we already in Miami-Dade County have many days with a heat index over 100. It's actually over 100 days. And according to the national, most recent national climate risk assessment, Miami-Dade County is projected to have the highest increase of days with a heat index over 100 of any county in the United States. So we have chronic high heat in Miami. It's a little different. We also have increases of heat waves across the country. And it's not just the health impacts, it's economic. And this was a study by Vivid Economics, which has now been bought up by McKinsey, where they looked at the labor productivity and workman's comp and health impacts just due to outdoor workers alone. And they also did it not only nationally, but in different cities. And for the Miami MSA, which includes Palm Beach County down to Key West, so it's about 6.2 million people. The average impact currently is about $10 billion a year on labor productivity costs alone. And then by mid-century, if we don't change our heat safety protocols, et cetera, is expected to double to 20 billion. All that's like getting a hurricane hit every single year. And we're not addressing in Florida like we're addressing hurricane. So in Miami, this is just data on our street emergency department visits. The spikes are summer months. The last two spikes are 23, 24. We have had just a the last two summers have been off the charts different. So the 14 years before 23, the average number of days at or above a heat index of 105 was 6. 23, we had 42 days at or above 105. And in 24, we had 60 days. And this was pertinent because we had advocated to the National Weather Service to lower our heat advisory and warning thresholds from a heat index of, the advisory was at a heat index of 108 and a warning at 113. The county had never had a warning in its history because it was ridiculously high. And I had to argue, like, we need to get practice on heat advisories and heat warnings. And our excess mortality study that was done, the other thing that they found was that the increase in deaths did not have some sort of like exponential curve. It was just a straight line increase. Once you get from a heat index of 90 going up, it was just a straight line increase. So we have to address and communicate risk from the heat index of 90 above. So what we did was create a heat season campaign, and I'll talk more about that later as a result. We also need to think about the compound risks of other hurricanes. We're obviously very prone to hurricanes. In the event of a widespread and extended power outage, we are serious during high heat times. We're seriously putting people at risk. And in 2017, Hurricane Irma, it wasn't that hot, but we lost 12 people in the county just north of us in a nursing home that had lost power. So now all assisted living and nursing homes in the state of Florida are required to have backup power to keep a community at a power outage. And that is pretty well enforced. So that's, but we still have a huge population that is not protected under that. And it's getting hotter in our cities, not only because of climate change, but how we heat up and how we develop our cities. And in Miami, we are sandwiched between Biscayne Bay and the ocean and the Everglades. Those are 5 to 9 degrees cooler than the city itself. But we worked with our university partners on a study placing stationary sensors in different neighborhoods in different contexts throughout the city, and found that even if you look at the Miami International Airport sensors, which is not exactly a well-shaded, protected area, right? We have neighborhoods on average functioning at 11 degrees hotter. Yeah, so you have a heat advisory at 105, 6 days. If you're at 11 degrees hotter, that is exceedingly dangerous. And so trying to how we figure out how to communicate between these different where you're at risk and where you may not be at risk is a challenge. And it's unequally, tree canopy is probably the best proxy for where our urban heat or lack of tree canopy, where our urban heat islands are. On the left is our census tracts by median income, the white and light gray areas being our lowest income areas. And on the right, our white and light green areas are our lowest tree canopy. White being less than 10% of the light green, less than 16 degrees, 16%. You can see how they're very aligned. So we did a heat vulnerability study different than most cities, the way they do it. Most heat vulnerability index use social determinants of health and some proxy for urban heat island to determine what geographic areas are most at risk. We started with health related data. So the 5 years pre-COVID again, but emergency department visits and hospitalizations related to heat, just because the numbers were higher and we knew it was heat. And what the top correlating factors were in those zip codes. The zip code was the highest geographic resolution we could get from the state health department. But the top correlating factors was high percentage of poverty, high land surface temperatures, so our urban heat islands, poverty rates, followed by high percentage of outdoor workers, substandard housing, mobile homes being somewhat of a proxy for that, and children. So this was marked, and the disparity in heat-related emergency department visits and hospitalizations was quite significant. So the darker red areas were experiencing 4 times the rates of emergency department visits and hospitalizations than the lighter yellow and light orange areas. So big disparity between these. The north central area, it's largely low income. It's hard to do minority communities in Miami because we're, the white non-Hispanic population is less than 15%. So, but this is low income, high urban heat island. In the deep south, it's low income, high percentage of outdoor workers. We have a big agriculture and industry operations down there. So we got data. Now we need to create a plan. We need to engage stakeholders. We did this in the way of a collective action strategy, so that it wasn't just a county plan. It was, how does the region work on extreme heat and the health and economic impacts together? And so I created a task force, co-chairing with Dr. Cheryl Holder, who's an internal medicine doctor, has worked her whole career with low-income minority populations and training doctors and nurses to do the same. She also is a co-founder of the Florida Clinicians for Climate Action, so she's done a lot of climate communication. And we had members from our state health department, our National Weather Service, our community-based organizations, university partners and members. We did a broad call for people in the community with lived experience, particularly from our more vulnerable area. We got a lot of interest. We offered to pay them a stipend to participate as decision makers on the task force. We had over 60 applicants, I don't know, or maybe it was over 70. Anyway, we picked 2 to represent on the task force, and then we did a series of workshops where we focused on a different issue each time. One might have been public education and outreach, and we'd make sure, or another one on housing, another one on outdoor workers. And each one, we made sure we had the right stakeholders invited to come, you know, and housing, all the housing people and outdoor workers, labor unions, different. And we provided translation services in Spanish and Haitian Creole. We had about 60 to 80 people in each of the 6 workshops, depending. And after a very brief, like 20-minute level setting presentation on what the issues are, what is currently going on, what some national best practices are, we divided people into small facilitated groups so we could hear from everybody and find out what people's pain points were and what their recommendations on what we could do together. Not government can save you, because government can't save you. And so what could we do together to address this issue? And they all these players are people that participated in those workshops, and they are part of our action plan going forward. The county is not leading on all the actions. We help monitor the progress and support the actions, but we are not leading on all the actions. One of the things, there's an old adage, if you want to go fast, go alone. If you want to go far, go together. And it takes more time. It definitely takes more time to get collaboration, but it does pay off in the run, and particularly now. So I'm actually stepping down from my role at the end of May. They are not replacing my position. But I'm working now and for the next 2 months, working on operationalizing as much as I can, not only internally in the county, but with some of its partners going forward. So there will be people working on heat in the county, but they won't have someone that reports directly to the mayor that's only focused on heat. So that's going to be a big loss, but it's what it is with our own doge. So our 3 goal areas are to inform and prepare people, to help people stay cool at home affordably, and make sure we have the backup power capacity to keep people cool in the event of a widespread power outage, and finally to do that urban heat island mitigation. I'm going to talk through each one a little bit more about what we've been doing, our success to date. So the heat season campaign. So our mayor 3 years ago, because we have chronic high heat, we declared May 1st through October 31st as our official heat season, and communicating that any day during that time, you need to take precautions about heat risk. And I had the benefit of marketing dollars the last 3 years to reach over 2.8 million people, 60 million impressions last year, but targeting those zip codes and neighborhoods that we found most at risk, and/or populations. We have specific messaging for pregnant people, for outdoor workers, for how to stay, no and low cost ways to keep cool at home. You really do need to message differently to different populations. We also worked with our emergency management and community-based partners on a series of heat safety trainings. First, to community-based volunteers. The emergency management for a long time has had this program called Citizen Emergency Response Team, and they train local volunteers to be ready to respond in any kind of disaster, hurricanes, et cetera. They had not had heat safety training. So we did an enhancement training for that, but then also just offered that heat safety training to any community leader that wanted to have it. And that was a more in-depth training to understand not only more about how heat impacts different populations and what the risks are, but also, and what to do to prevent that, but also how to know the signs of heat stress, of heat rash, heat cramps, heat exhaustion, heat stroke, and how to respond in each of those. We gave them heat response kits. And then I took that out on the road. I did the heat safety training for summer camp counselors and early childhood educators, for our homeless outreach teams. And then we made sure that homeless outreach teams had water, cooling towels, sunscreen, electrolytes, various things to help keep them comfortable during high heat times, and providing transport to cooling sites. Although some chronically homeless will not even accept the transportation if it's offered. So you need to make sure that they have something that'll keep them cool on site. I talked about updating the heat advisory and warning thresholds. We also updated the response protocols. We made cooling sites available throughout the summer, and upped the access to that information and gave training to the cooling site staff. We worked with the homeless outreach team, outreach organizations on identifying specific cooling sites for that population, where they could lie down and rest and have more extended hours. And worked on a series of trainings with employers and workers on heat safety. We did attempt to have a heat safety standard at the county, but it was preempted by the state. So now our focus is more incentive-based. We're working right now on a mini grant program for small businesses where if they show they have heat safety protocols, they can get access to a grant to buy insulated water kegs and shade structures, temporary shade structures. And then we have a monthly urban heat research group, which has been super valuable to me. It's coordinated by one of our local research universities, University of Miami, but we have research universities participate from all over. And it's a time for faculty and grad students to present their work, but also myself and other practitioners to present their programs and try to get more relevant research to our work. So that's been very useful. And I mentioned it to the faculty. If there is research that you think might be of interest to practitioners and or other researchers in Miami-Dade County, please reach out. We can see if we can get you a presentation, and you're also welcome to join anytime. I mentioned the heat season campaign. One of the partners, I didn't mention the trainings we did with the healthcare community though, because Dr. Cheryl Holder and Baptist Health led a continuing education series for nurses, doctors, and all different fields related to heat. But they also did outreach to federally qualified healthcare centers and other doctors' offices and gave out materials. And they did a post survey on what people's response was and found that placing just posters and physical handouts in doctors' offices and clinics was incredibly helpful for education. There was a lot of retention. Doctors and nurses are the most trusted messengers in our community. That's been documented. And people have time on their hands when they're in a waiting room. And so it's been a really, really low cost, valuable education tool. Our goal too is to help people stay cool at home affordably and make sure we have backup power. We wanted to make sure everyone under the county's care, we have a pretty large public housing platform and affordable housing portfolio in the county. We assessed which ones had either, it's mostly inadequate cooling, not no cooling in Miami, but and installed 1,700 efficient AC units in those areas. We also doubled our dollars for weatherization, and that NOAA stands for naturally occurring affordable housing. In other words, it's cheap rent because it's probably substandard housing. So that we dramatically increased the funding for that. That is not going to be able to continue in going forward. And out of that funding. And do a lot of education around no and low cost things people can do and access to resources for renters and homeowners about what they can do. The County Sustainable Buildings Program, again, this is leveraging where our dollars come. We require for any building that we fund or finance, in other words, our affordable housing, but all buildings, they have to have a cool roof. They have to be built to LEED Silver standards and have to be solar ready, have to have access to be EV ready. So that's been a very powerful program. Our building department worked with the state on a ordinance to require cool roofs for all commercial buildings and to and now I'm working with an International Code Council on indoor cooling standards. We have heating standards across the country. It requires buildings in Miami to have heat. They don't require buildings in Miami to have air conditioning. Which is kind of ridiculous, but anyway, so we're working towards that to be in the international building code, so then states can adopt that code. And finally, we worked with the Arch Rock Resilience Center and Jacobs Engineering on a strategy for resilience hubs, which are community-based centers, largely, libraries, community resource centers, rec centers, trusted spaces, could be a faith-based community, trusted spaces in a community that we already know has a lot of vulnerabilities, where they can do year-round programming around resilience, but also serve as a touch point during disasters where people could go and get access to services, charge their phone, pull down, medicines, whatever they need. So that's the resilience plan I'm going on. The last goal around urban heat island mitigation, I see this as where this is our longest term play, and probably will transform the city the most in terms of health and economic outcomes. And it's also where heat and flood and carbon mitigation can actually all be. But you can do the same in the built environment, but as well in our urban landscapes, and where the county can have a lot of impact. We've doubled the last 2 years our annual tree planting from 8,000 a year to 16,000 trees a year, focusing more on shade trees and focusing a lot more on our lowest canopy areas. And we give grants to our municipalities. We focus that on municipalities with low canopy much more, gave them much more, require much less of a match in that funding. Just last week, the mayor gave me a second job title a couple of years ago as Director of Urban Forestry. And so I worked on creating the Urban Forestry Plan, and that is 100% focused on how do we get from our current 20% countywide tree canopy to 30%, focusing on our low canopy areas. It is also a collective action strategy. In other words, we have to get our municipality, our school district, our faith-based organizations, our private sector, our private property owners all on board, or we will not get to our. I mentioned this earlier. We did get investment to make sure that every bus stop in Miami-Dade County has a bus shelter. We're still in the process of installing those, but in the process, we also worked with our university partners on placing sensors at unsheltered bus stops with tree canopy, without tree canopy, sheltered bus stops with tree canopy and without tree canopy. Tree canopy by far is the biggest cooling. Bus shelters, at least in Miami, not so much. Really not much of an impact. Certainly keep you from the rain and keep you from certain wind and other environmental impacts. So, and the benches are probably a little better than the ones. Some of our bus stops didn't even have a bench before. So, it'll still be an improvement, but we still need to figure out the cooling at those locations. We've partnered with both schools and faith-based. We're providing actually technical assistance and funding to plant trees in those areas, and working with our community-based organizations and launching what we call a Tree Leaders program, where community leaders from our target areas, trusted members of the community, we are paying them to get trained on all things about benefits of trees. They're already advocates for trees, but they're getting trained on benefits. What are the issues around siting trees in right-of-ways? And they're helping us organize events at faith-based and school-based. We're about to propose an update to our landscape code, I'm very excited about, very nervous about whether the commission will approve it, because we're actually going to require, so developers right now are required to present their landscape plans before they can get their landscape, their whole building, their proposed development approved. And they do some cursory check to make sure those trees are planted at the beginning. But there is no follow-up. There is no requirement to maintain those trees. There's no follow-up, and we lose those trees all over the place. This is going to require them every 10 years to be recertified. And we're going to go back pre-landscape code time and require those properties to come into compliance with the landscape code. So we'll see. Wish us luck on that. And we're trying to strengthen our tree protection codes at the same time. Our parks have been great partners. They've invested more shade structures, overhangs in all the buildings they're creating. They're doing nature-based playgrounds with more emphasis on tree shade than just man-made shade structures. A lot more outdoor water fountains with the water bottle refill access, and splash pads, and trying to increase their pool access hours. So just on urban heat island a little more. So dark and impervious roads are absorbing heat, re-radiating heat. That low reflection actually increases global warming. And it makes the runoff hotter, dirtier, and creates no shade. Same with parking lots, it increases air pollution. The dark impervious roofs also makes your buildings less efficient, thereby requiring more AC, thereby creating more waste heat into your urban heat island. And with not very high investments, cool roofs, high albedo roofs actually cost no different than a low albedo roof. And it can save up to 15% in your AC. And that high reflectivity does bring down global warming. Porous, pervious pavements and can address flooding as well as heat. And certainly any green infrastructure can help with air quality, flood risk, and heat mitigation. So that's a big focus of our office going forward, is this urban heat island mitigation integrated with our flood mitigation work. So those are my comments. That's my email, jane.gilbert@miami-dade.gov. You're welcome to reach out. That's our website. It has access to our plan, the vulnerability assessments we've done, and analysis. So that is it.
Any questions?
Yes.
One question, with the recent political climate, risk for people who might not be here legally, I'm wondering if people want to seek out healthcare or emergency treatment during these things.
Yeah, it's a great question. So, yeah, no, we definitely find that undocumented are reluctant to go to any of our government approved facilities. And again, it's not, our heat waves are from May, October. So it's a challenge. I am now just this year piloting, working with some nonprofit organizations to have officially designated cooling sites. Our cooling sites, to be honest, are not used that much. And I think it's because we have such high AC penetration in Miami that there are many places, if they can't get cool at home, they have relatives or they have other community spaces they could just know to cool. Of course, we don't know really, like our libraries are a cooling site. I don't know if someone's going there to apply for a job, read a book, or cool off, or all three. You know, so So that's a challenge, but our homeless population has always used our libraries as a cooling site, frankly, before they were designated, but yeah, it is a challenge, that piece of how we provide services to that particular population. And as a government entity, it's a particular challenge, which is why, you know, our heat outreach, we're now doing those trainings of community-based volunteers. We're actually doing train the trainer through our community-based organizations. It's not a training that I or the emergency management is delivering. It's our community organizations that are delivering it now, because we're trying to exactly that, have them do it in the spaces with people that they trust and languages they can understand and all of that. So great question. It's an ongoing challenge.
I have a question. Thanks for your insightful talk. I'm not that familiar with Miami, so I searched for its historical weather, and I found that the temperature in July, August, even September was almost stable. Was almost around like 55, 53 Fahrenheit. So I'm wondering, would the
No, that doesn't sound right. Fahrenheit or Celsius? This also doesn't sound right.
sorry, 80, 85 Fahrenheit. Yeah,
Right, but that's temperature.
yes,
So-
temperature.
We look at heat index because we also have 70 to 80 degree humidity. And because really your body responds to humidity, temperature and humidity as part of how we cool. So through evaporation, so.
Yeah, since I looked at the temperature, so I was wondering.
Yeah, we don't hit a temperature of 90 very often, but we do. But at a temperature of 85 with a humidity of 70 or 80, you're at a heat index of over 100.
But if the heat index was also stable during that several months, so would there be the same warning throughout those
Great
those
question.
stable months? And how could you quantify the health and economic burden during that stable months?
That's a big question. So I'll answer the first. So we did lower our advisory and warning thresholds from 108 and 113 to 105 and 110. Based on, we didn't want to have it too often that we were doing heat advisories, but that was based on historical data of that average, I said 105, 6 days a year. And then the last 2 summers, we had 42 and 60 days where we had heat advisories or heat warnings. And last summer in particular with the 60, we got feedback, it's too much, people are droning it out. So we're trying to figure out how to do that. Now, the heat season marketing campaign goes, you know, I have billboards, bus shelter ads, bus wraps, digital marketing and gas stations and even in hardware stores. And that's just there. It's not only on heat advisory days. So we're trying it from different channels, but we're now looking at how do we shift our messaging with the heat advisory. The National Weather Service is also contemplating moving. On the West Coast, they've already moved to this heat risk tool, which is color coded rather than heat advisory and heat warning, which is a much better system. Problem with the heat risk tool is it doesn't use heat index, it uses temperature. So I'm working with NOAA now on if they can calibrate it as long as they stay that staff is still there for a little bit longer. But anyway, we're moved there, not this summer, but next summer, they're hoping to move at least to a color-coded system that's based on heat index, which I find is a much better way to communicate heat risk, where like At 90 and above, your most sensitive or vulnerable exposed populations with high exertion might experience heat stress. What is it at 100? What is it at 105? It's a different level of precautions you need to be taking. And it mimics how air pollution risk is communicated. So I think that's the future of communicating heat risk. I don't know if I answered that, but on the health and economic impacts, we're doing our best. You know, we got that study with on labor productivity, but it is very hard to get data on because it's not just about heat exhaustion and heat stroke, it's cardiac arrest, it's COPD impacts, it's pediatric asthma, it's preterm births, it's mental illness impacts. Those health impacts are very hard. And it's also very hard for me to know how many of those are happening in the home, in the workplace, recreating, walking and waiting at a bus stop too long. Like that data I don't have.
Thank you for your talk. It's very interesting. And I have a question about kind of the initiative that you talked about with trying to expand tree cover and like greenness. And I was wondering about kind of like, just like, you know, like there's sometimes where like green gentrification can occur where like, you know, adding additional green spaces can cause like property value or like cause like residents like have to move out, things like that. And so I was curious about like if your urban greening initiative has like any like kind of like I guess like preemptive ways to address that. And if there's any like complication also with like how property values are changing with due to like sea level rise and how like a lot of like more coastal areas property like and how like more like areas further from the sea and like more elevated areas but like
Yeah.
Yeah.
Great question. I don't have an easy answer for you. I don't think the county has the capacity to do that preemptive work now. I will say that's something I'm really interested in my post-county life is to work in specific around zoning overlays to prevent that gentrification. But what we are doing is that tree leader. We find that, you know, even though everyone says they like trees, there's a lot of challenges getting people to be receptive to trees in their right away. Because they use it for parking, they don't want the debris from the trees on their house or their cars, they don't want to maintain the tree. So that's part of what we're hoping with this tree leader program and other outreach is to help build an understanding of the sort of, yes, you'll get tree debris, but these are the benefits to your property values, to your health, and hopefully get more buy-in that way. But it is a risk. The gentrification is a risk. I would say in most of the areas we're focusing on, because Miami is just booming, it's a very counterintuitive thing, is booming, is that these areas are going to gentrify whether we plant trees there or not. So, you know, that's those are so we have to just
Hi. I found your presentation very interesting because it gets the gears turning about the ramifications of extreme heat on other public health issues and solutions. So I'm thinking specifically about the obesity crisis in the South and whether or not there's a concern for the continuation of physical activities and then outdoor wellness programs in Miami during these extreme heat events and what you know about that.
great question. So that's one of the reasons greening is so critical is that people can't play outside, can't walk, let alone run or recreate in other ways without shade outside. And I do think that, you know, it's our high heat neighborhoods are also our high other social, you know, other health impacts, cardiac arrests, diabetes, COPD, other, you know, I haven't looked at obesity, but I would guess they're some of the same neighborhoods. So I think having our partnership with the parks is really critical. They understanding that they've got to look at shade. I haven't won them over on doing something else other than AstroTurf on playing fields, but which is a big risk issue, but they are being friendly to understanding that you can't expect people to walk around a park in the middle of July if you don't have shade. So yeah, and there was this great study out of University of Louisville recently where they got the funding to plant 8,000 mature trees in a low moderate income neighborhood and then do a control study with a similar demographic neighborhood without the trees. And they've seen inflammation go down, they've seen cardiac disease go down. So we know it's not just, the other social determinants of health. Trees themselves have made that impact. Pretty powerful work.
We have time for one quick question.
Yeah, thank you for sharing this important work with us. I was wondering, you showed us the economic analysis, right? Where you put a number to the productivity loss. Can you talk a bit more, how have you used that data? Have you noticed that having that number has kind of like attracted other policymakers or other levels of government that probably don't think about heat, and then when they notice, because they don't care about health, or like they don't think about health, but when they see that it entails like an economic loss, maybe they start to think about it as well. Like, how have you used the data and has it been useful? So
Mostly I've used it with employers around food safety, that like if you have simple water and rest break schedules, water and food safety education, that you can actually reduce the productivity loss and certainly reduce your workers' comp claims. And I also have them, they have to look at not just heat exhaustion, heat stroke, but all workers' comp claim increases during high heat time. Because you're missing, if we know from other research that injuries on the job increase during high heat times and other outcomes. So so mostly I've used it for that. What we really could use is a better understanding of the health costs of urban heat islands, the health costs of an inefficiently cooled or undercooled home, so that we could capture some of that. Like, shouldn't Medicaid and Medicare be helping finance some of these because it's going to reduce their costs? We don't have that data yet, but that would be really useful.
Great. So please join